Good evening, Melbourne. Magandang gabi po sa ating mga kababayan. Good evening, Filipinos and Australians in Victoria. This is our second Zoom session, second Zoom information session. We had a very, very good response before, and we're doing this for the second time, this time to address the queries about vaccination for kids between the ages of 5 to 11. So we have the privilege of having very good presenters again from the Water Well Project. And also in attendance are our coordinators from MyCare. This is actually brought to you in cooperation with MyCare and Brimbank City Council and funded by the state government of Victoria. So I'll pass you on to our presenters to introduce themselves. First off is Liz, who we're having, Dr. Liz is from Hobart, and we're having her for the second time. Welcome back to GAWAD KALINGA Info Session, Liz.
Thank you for having me back again. Like Marissa said, we're really happy to be here. My name's Liz. I'm a doctor. I work in Hobart in the emergency department here. I'm originally from Melbourne, and I've been working with the Water Well Project now for 9 years, so I feel very happy to be here. There's 3 of us here presenting, so I might just pass over first to Tracy and then to Michelle, and we'll all introduce ourselves.
Hi everyone, I'm Tracy. I'm a registered nurse and nurse researcher and health educator with the Water Well Project. I'm really glad to be here today. I'll hand over to Michelle.
Great. So nice meeting you all, everyone. My name is Michelle. I'm one of the junior doctors currently based in Sydney, and I've been volunteering with Water Well Project since last year. And what I'm currently working in is with obstetrics and gynecology, which is basically women's health. And I've also got a bit of experience in babies as well, like NICU experience. Yep.
Fantastic.
Go ahead, Liz.
So if you're happy, I might start sharing the screen. Tracy's going to introduce us, but we'd just like to highlight we're going to try and keep the presentation relatively short. We've got some PowerPoint slides, but we're really keen to hear any questions. I think Marissa or there might be a chat that you could send in any questions, and anybody that's on the Zoom call, please feel free to interrupt us or put it in the chat. We'd like this to be kind of a general session, and we'd like to be able to see what your questions are. That's the main thing. Okay, so I'll share my screen now. All right.
So while Liz is doing that, maybe I'll introduce the Water Well Project. Before we begin, I'd like to acknowledge the traditional custodians of the lands on which we're gathering, realising that there's a number of us from a variety of places, and pay my respects to their elders, past, present and emerging. So we're from the Water Well Project, which is a not-for-profit organisation that provides healthcare information to communities from migrant, refugee and asylum seeker backgrounds. All our sessions are facilitated by qualified and registered health professionals here in Australia. Today, as Marissa mentioned, we'll be discussing COVID-19 and children and vaccinations, and we really would love you to get involved. As Liz said, just with as many questions as you have to ask. For those on the call, you can ask your questions at any time. Just raise your hand or just speak out or post a question in the chat. For those that are watching the live stream through Facebook, please register your questions and Marissa will pass them on to us. Just to note that everything we talk about today is generalised information. We can't offer personal advice for personal situations. We also want to acknowledge that the information we provide is from an Australian perspective, and we recognise that here in Australia we're really lucky to have a well-resourced health system and a strong COVID-19 response. So we just wanted to put that perspective out there. So I might just hand over to Liz if you'd like to start us off.
Yeah, great. Can I just check, can you just see my slides?
We can see the notes as well.
Yeah. Oh, can you? Yeah, that's what I was wondering. Let me just stop sharing for 1 second. Sorry for that, everybody. I don't know why.
Liz, when you click share screen, if you go to advanced settings, you can only share a portion of your screen, even if you're in a presenter view. So you can only share your slides in that way.
Do you want to share, Michelle? Will that be easier? Do you have the slides? Or
yeah, sure.
I don't know why it's showing so big. I'm so sorry.
No worries. Let me do that. Motion screen.
Melvin, does
Share.
Michelle have a sharing? Okay.
Yeah. I'm just going to just change the size of the screen a little bit. Does that look okay?
That looks great.
Excellent. Yeah.
So we always like to start our sessions with a little bit of a conversation, and we'd love to know if there's anybody on the Zoom call that wants to share any stories they might have specifically about children and COVID. There's a lot of stories. We've heard about schools, we've heard about testing. Does anybody have any stories about how they've managed with their kids at home with COVID, or how their kids are going missing school? I wonder if anybody would like to share a story.
Audience, would anyone want to share? Just raise your hand or let me know. No?
Otherwise, I have a pretty funny story. I know at the moment in Tasmania anyway that all children going to school have to have RAT tests. So one of my friends, she's got 3 children. Every 2 days she has to RAT test her children. She was telling me the other day, she put them all in bed, she did their RAT test quickly, put them on the bench and then went to do something and came back and she saw that one of them was positive, but she had no idea which child it was. So she had to wake them all back up to test them all again. So I think we've probably all got kind of similar stories like that, but people are used to doing RAT tests now, and it's pretty common that we're doing tests quite frequently, even if we don't have symptoms. So all of her kids were well, and she had no idea which one was actually the sick one. So she was kind of lamenting that she had to test them all again. It's pretty funny. I don't know if you wanted to share anything, Tracy, or if we just move on.
Yeah, well, just on what you said about the kids being well, my kids had experience of COVID over Christmas, which was very sad for our Christmas day. We didn't get to see any family, but they were actually sick. So they all had symptoms, but they all had different symptoms. And it was really interesting. Just, you know, one of them had a fever which lasted for days. Another one had, you know, a runny nose, and so those real cold symptoms. Another one was fine until about day 4 and then went down with just really bad fatigue. All of them had a sore throat, but each one of them, same situation, same family, but completely different symptoms. So it was something really interesting to see as well.
Yeah. All right, Michelle, maybe you want to talk us through the next slide, COVID-19 infection and in children.
Yeah, certainly. So moving on, I thought I'd just talk a bit more about how COVID infections would present in children. So in general, as you guys may be aware from your personal experiences, kids usually present with a milder infection comparing to the adults, with symptoms quite similar to common cold or flu. However, we cannot ignore that COVID-19 can still be a serious condition. Some people with pre-existing medical issues are at a much higher risk of severe conditions. And in those kids, such as people with like leukemias, with background cancers, it can lead to be a much higher hospitalization and intensive care admission rate as well. Certainly, it's also true for people who's be pre-exposed to certain medical conditions like even prematurity, obesity, or if they're on any medications that could decrease the effectiveness of their immune system. I'll pass it on to Tracy for the next slide.
Yeah, just before we go to that, we did get a question that was sent in just before the session started on what are the long-term effects of COVID-19 on children who are unvaccinated. So it might be a good time to address that just while we're talking about this topic.
Yeah.
So the research in Australia says that between 37 and 68% of children and adolescents have mild symptoms, as Michelle just pointed out, and 16 to 28% have no symptoms at all. So a bit like Liz's story there, there's families where your children may have COVID-19 and not know about it. because they don't have the symptoms. It's only testing that shows it. The most common symptoms in children tend to be a runny nose, a fever, cough, and a headache. Some children also get nausea and vomiting and diarrhea, which can be quite unpleasant. And symptoms can last for weeks, and there is long COVID, which many of us have heard about, I'm guessing, where symptoms last for weeks and even months. And that's less common in children, but it can happen with some children. And there's also a life-threatening condition that has popped up just rarely with some children who have had COVID, which is a pediatric multisystem inflammatory syndrome. And they've found that this can cause inflammation in heart, lungs, kidneys, and can really impact kids. Some kids may have it mildly, some kids may have it severely. It's not common at all, it's quite rare, but it has been one of those things that I've heard being talked about and people saying, oh, what can we do? But vaccination does protect against that because it does prevent those children from getting COVID in the first place. So they're probably some of the long-term effects. The key is just to keep an eye on your kids, and if they're feeling particularly unwell and you're concerned about them, just seek medical care.
Tracy, do you know, I had a bit of reading as well about this. Do you know, does it make a difference if your child's unvaccinated versus vaccinated getting long-term effects of COVID?
Well, I guess the studies that I read said that vaccination is the only protection that we sort of really have against this particular condition. It's popped up reasonably recently, or it's come to public knowledge reasonably recently. So vaccination is really important. But vaccination doesn't necessarily stop our kids from getting COVID. It's just been proven to reduce the severity of disease in many people who might already get COVID. Yeah,
that's what I read as well. I read that they weren't really sure about the long-term effects, but that definitely we know having a vaccine does reduce how badly you can get COVID at the time.
Yeah, and I think when time passes by, it will become clearer as well. There's certainly quite a few, trials that's been recruiting people, looking at the long-term effects of kids having COVID. So maybe 2 or 3 years later, we will have a clear idea about the long-term effects of children who've had COVID.
Yeah. All right, should we go back to our slide? Yeah.
Sounds good. So moving on.
So I think we're all we can answer your question, Marissa. I'll put that in the chat in a second.
Oh, I'm doing that at the moment.
Oh, thanks, Tracy. That's great. So I think we're all pretty used to, do we have COVID? What's happening now? So we won't spare too long on this, but as we mentioned before, some schools, it's mandatory that children are checking, or it's highly recommended. Otherwise, there's lots of reasons to get tested. We know if you know you've had a close contact, if you've got a cold, like we said, if you've got vomiting, diarrhea, fevers, headache. In terms of testing, you can have just a RAT test, or you can have a PCR test, and you need to isolate or stay at home once you've had your test. Most children, when they have COVID, like we've talked about, can be cared for at home. When we did this talk last year, we were talking lots about people going to hospital and getting very sick. But at the moment, with the current variants of COVID-19, we know that most people, and specifically children, can be cared for at home. This is the coronavirus health information line. I believe this is the Victorian number, but there's different numbers for different states. And if your child's unwell, or you think their breathing is not very good, or you're worried about how much they're eating and drinking, you can always take them to your nearest hospital or call 000. Obviously, I didn't mention, but that in terms of isolating your children when they have COVID, shouldn't be going to childcare, shouldn't be going to school, okay? And at the moment, that's kind of the case if they've got a sniffle as well, but I know that's extremely challenging.
Definitely.
Yeah. All right.
Tracy, would you like to talk about vaccines for children?
Sure, I've just posted that answer up on the chat. Yeah, so we have a range of information on vaccines. So basically children aged 12 and up are eligible for Pfizer and Moderna vaccinations at the moment, with a dose interval between 3 and 8 weeks. Children aged 5 to 11 are recommended a paediatric Pfizer dose. So it's a smaller dose, which is based on the maturity of the immune system. So children's immune systems mature at a different rate. They're not as mature as adults, so they have a paediatric version, which has been worked out to be effective and safe in that age group. The recommended interval is 8 weeks again, and it can be shortened for kids with particular circumstances. Say if they were vulnerable with some pre-existing medical conditions, they may have it sooner. Recently, they've also recommended the Moderna vaccine, which is an alternative option for children aged 6 to 11 years old. Once again, it's a smaller dose than the adult dose, and the recommended interval is 8 weeks apart, which once again can also be shortened given a child's circumstances. But it's important to note that Pfizer remains the only vaccination available for children who are 5 years old. And there's no vaccinations approved in Australia at the moment for children who are 4 years old and under. It's really important to remember too that when your child is vaccinated, it does take a couple of weeks for that vaccination to take effect. So still take precautions to protect your children from exposure to the virus while that vaccination is doing its thing within their bodies.
Excellent. Any questions so far in our audiences? No?
My question is, Tracy, if your child's had COVID, should they still have the vaccine?
Absolutely. So if your child's had COVID, they'll have some immune response, which will protect them against COVID again, but they certainly can get COVID again. My niece just this week picked up COVID for a second time this year, and she's very upset about it. So we do recommend that you proceed with your vaccination with your next dose once your child is well again. So we would like people to wait until their child no longer has symptoms and is feeling well before they get that next vaccination.
Definitely. And I think the recommended interval at the moment, if you have chosen to delay your COVID vaccination because you've had COVID, would be 4 months. So from the first 1 to 4 months, you might still have some immunity, but afterwards your antibodies start to drop, and we will still recommend that you get the vaccine booster dose, or if you haven't had the second dose, to get it to be able to prevent severe illnesses as well.
And anyone?
And just, sorry, I was just going to say, just on booster doses. So a third dose is currently recommended for children aged 16 and 17. But there's not a third dose at the moment for younger children unless they have a medical condition, in which case it is recommended.
And where at least in Victoria and in Tasmania, I think New South Wales, where can you take a kid to get vaccinated?
Yeah, it does vary. So doctors' clinics, some of them do it, some pharmacies. If you look, for instance, online, I booked my children in for my older children in for a third dose the other day, and I'm going to my local pharmacy. Not all pharmacies will provide a vaccine to younger children, so it's maybe worth a call to your local pharmacy or GP's clinic to ask. And there are, of course, vaccination hubs around the place run by state government, where you could also make a booking.
Perfect. I think that's the important thing. I think especially for kids 5 to maybe 12, I'm not sure that all pharmacies feel confident to do vaccinations. So that might be a time that you have to take your child to a GP. Great.
That's good advice. Okay. So moving on, we're just going to talk a bit about COVID vaccination in pregnancy and breastfeeding as well. So a lot of people might be concerned for vaccinations in pregnancy, but is it actually safe? So the question to your answer is the COVID vaccines has been shown to be very safe in pregnancy. So even though the initial trial, the one that developed the COVID vaccine, didn't include pregnant women, there has been multiple trials afterwards looking at the safety profile in pregnant women. So there has been a large US study of more than 35,000 women looking at the side effects of receiving COVID vaccination in a group who's pregnant versus a group who's not pregnant. And it has been demonstrated that the safety profile is essentially the same. There's also been specific studies looking at pregnancy outcomes for these women who's had COVID vaccinations. One of the very famous one is an Israel study looking at more than 7,000 women who are pregnant and non-pregnant. And this has showed that there's no adverse pregnancy outcomes such as like preterm labor, stillbirth, etc. because of the vaccination. And I would still highly encourage people to get vaccinated, especially their booster dose as well when they're pregnant, just because that the risk of you getting severe illnesses when you are carrying a baby is much, much higher than the general population. For example, if you get COVID while you're pregnant, your hospital admission rate is actually 5 times higher than the general population, and you're more likely to require ICU admission or even using a ventilator to help with your breathing. And it's not just affecting the woman alone. A lot of times it means a higher risk of having preterm deliveries, means baby born more earlier than 37 weeks. And in that sense, baby will also require higher admission to newborn care centers or ICUs because of that. Do you guys have any comments to add on regarding pregnancy and vaccinations in this sense?
I just have a question, Michelle,
Yeah.
on vaccination for pregnant women.
Yeah.
So when a pregnant woman is vaccinated, does the immunity or the medicine transfers to the unborn, the fetus?
So there has been some studies looking at that, but certainly there's not enough evidence to say that it will be adequate to provide the kids the antibodies to prevent them from getting COVID. But certainly there has been studies showing that there's some passage of the antibodies through the placenta to the baby. But whether or not that would be enough for preventing the illness after babies are born is still unsure. And the other thing about when after baby's born, people might be concerned about passing medications or vaccine particles through the breast milk. It actually doesn't happen. The study has shown that. So it's also very safe if you are breastfeeding and you want to get a vaccination at that time for COVID. And the recommended vaccination while they're pregnant would be Pfizer or Moderna, one of the mRNA vaccinations.
With the pediatric Pfizer, I'm assuming the reason why it's called pediatric Pfizer is the strength is lower than that of the adult. So why can't we give it to kids aged 1 to 4 if it's the pediatric dose?
I can answer to that if you like, Michelle. So
yeah, great.
With the problem with vaccines and for everything is that we want to make sure they're as safe as possible. Everybody is very nervous about side effects from vaccines, and we're going to talk a bit about that. I know there's some questions about that as well. And we know that, as we've already alluded to, that children aren't getting as sick as adults for COVID. So that's why it took a long time to make sure that the vaccines are safe, because we need to make sure the safeness of the vaccine weighs up with the safeness of getting COVID. So all of the research so far, they started off with adolescent children down to 12. That's why that was introduced first. And now the research has extended to 5 to 11-year-olds. And that's the dose we have is safe for that age group. So that's the dose that's been studied, the pediatric dose. It's actually a pediatric dose of both Moderna and Pfizer. It's a smaller dose than adult. There's not enough research for the ATAGI, the Australian immunisation body, to approve vaccines for children 1 to 4 yet. I believe overseas there are some countries that are already giving the vaccine, but we're speaking about Australia here. They're trying their best to make sure the risk of having the vaccine is less than the risk of having the illness. And so they're very, very careful. So it's potential that in the future we will have a vaccine for younger children, but at the moment we're just using the studies we have, the evidence that we have, and we've been very careful with that, which is why we don't have one yet.
Thank you, Liz.
Excellent. Now moving on to talk about COVID vaccine and whether it impacts fertility. Tracy, would you like to comment on that?
Sure, yes. So there have been studies done to examine this. So when the vaccines were being developed and testing was happening, they found that pregnancy rates between people who were vaccinated and who were not vaccinated were equal, which demonstrated that the vaccine does not impact on people's ability to become pregnant. And there are also studies done on people undergoing IVF treatment. And that was really interesting work. And it showed that for both women and men, so for women, the quality of their eggs were not impacted by being vaccinated. And for men, the quality of their sperm and their sperm count were both not impacted by being vaccinated. So the vaccines were safe and didn't impact on fertility. But another interesting finding in the men's study was that COVID-19 infection may impact on the quality of a man's sperm. So the COVID-19 infection may actually have an impact. So we really strongly recommend being vaccinated as a precaution because we know that it does protect people during pregnancy and those who are planning to become pregnant.
Definitely.
And I think we speak about this because when the vaccines came out, this was a really big concern for a lot of people. There was a lot of concern that the vaccine might affect people's ability to get pregnant. And so it's great now that we have the studies to back up to show that this is not the case. All right. I might talk to these side effects, hey?
Mm-hmm.
I think we know a lot of these. I hope that most people watching have at least had one vaccination. Okay, so the side effects for children getting a vaccine are not very different to the side effects for adults. The most common thing for people is to have a sore arm where they got the injection and to feel a little bit sick, like having a cold. So a headache, to have pains in their muscles and their joints, like their knees or their hips or their elbows, okay? And some people might have a fever or chills. People can also feel quite tired, so you might find they feel tired for a day or two. I think Tracy might have alluded to this, but everybody is reacting very differently and it's a little bit hard to tell. So we can't say, you know, every child that's 10 is going to have this. We don't know. Some people get a sore arm only, they don't even know. And then some kids are in bed for, you know, a few days. There are some more serious side effects that are very uncommon. One of them is the allergic reaction to the medicine. The medical word for this is anaphylaxis. You might have heard this word before. If this is the case, people get a severe reaction normally relatively quickly after the injection. And this is why when you have the injection, the GP or the clinic asks you to wait around for 15 minutes. This is the reason that you might get the severe reaction. If that happens to you or your child, you might need medical assistance. And there's actually some special clinics that can help to see if you can have the vaccine again, the next one, okay? The next thing we'll talk briefly about is this cardiac or this heart problem that I'm sure a lot of people know about. Again, the medical word is myocarditis or pericarditis. Essentially, it means swelling or inflammation of the heart. Sounds very scary. I know no one wants to have any infection or inflammation of their heart. And the main way this can present in adults or in children, it's a bit harder in children if they can't explain it, but it's the same, is feeling maybe short of breath, difficulty breathing, and some pain in the chest, okay? We're seeing this, I work in the emergency department. I'm seeing people come with feeling of chest pain almost every day, but they very rarely actually have this condition, okay? We're seeing it within 2 weeks of the injection of the vaccination, and it's got to do with just how the vaccine is made. What people need to have is they need to have an examination by a doctor, they need to have an ECG, so a tracing of the heart, and they need sometimes some blood tests. okay? Even if people have this condition, then it's pretty mild and it can be managed just with a medicine like Nurofen, okay? There are some more severe ones of it, but we're hardly seeing it. I think the rate is like less than 1%. It's much, much less than if you actually get COVID. So you can also get pericarditis or myocarditis if you get COVID, and the chance of getting this from COVID is more than getting it from the vaccine. I might also
comment on the rates for myocarditis and pericarditis as well, because I think there's a question in the chat box. Does it mean that there has been a case like this before on children who've had the COVID vaccination and getting myocarditis? So I had a look at the Monash University. They have a vaccine report that they update regularly, and the risk of perimyocarditis, if you're a female and you get a vaccination and you're a teenager, 2 conditions, it is 10 in a million people. So that would be, if you jab 100,000 people, you have 1 case, okay? And it's a bit more common in teenage male, which is 67 in a million people. But when you think about it, it's still only 6 cases in 100,000 people. So that's still a very, very small number. And nearly all the cases that they have reported as mild or pericarditis in that sense are very mild form of it and are all conservatively managed. However, if you look at the data about how many COVID-induced perimyocarditis there is, it's actually 450 in a million. So it's nearly 8-fold higher than the baseline, and they are much more severe forms. So certainly COVID-induced cardiac inflammations are a more higher risk and also more severe form of this condition. Yeah.
Hey, Michelle, what does conservative management mean?
Conservative management means you can manage the symptoms using some medications like pain reliefs, like anti-inflammatory like Nurofen or like Voltarens. Also means that you don't need to actively treat it. You let your body to fight with the inflammation itself and let the symptoms subside by itself.
So it means like no surgery, not really any need to go to hospital. No. Sometimes you need to go for a blood test, but normally it doesn't mean that you really need anything.
Certainly. Excellent. All
Sorry,
right.
Michelle, so are you saying that the myocarditis and pericarditis symptoms were just temporary? It's not a long-term condition?
That's correct. That's correct.
Oh,
it's an acute condition. It's an acute inflammation of your heart. And after the condition subsided, you should not have any long-term effects from that.
Great. Thank you.
No problem.
And people can actually have the vaccine again. Say you got pericarditis after your first vaccine, you are still allowed to have the next dose. You just have to make sure you see a doctor before that happens.
Excellent. So moving on, how can we protect our children? Tracy, would you like to comment on that?
Sure. Well, we've talked quite a lot about vaccination. That's obviously a key way that we can protect our children. And the other ways are just those COVID-safe behaviours that we've been hearing about and doing ourselves in day-to-day life for a couple of years now. So things like opening the windows and letting the air flow through, gathering outside rather than inside where possible, wearing a mask in the places where we need to and where we can't distance, socially distancing from one another. Just those things that we've been doing, just following the measures that are in place in the different places that we live. So there's different measures in place in different states of Australia and in different places in the world, depending on the situation at any given time. So just being aware of those things, and that's particularly important for children who are not old enough to be vaccinated. We spoke before about children who are 4 years old and under not being eligible to be vaccinated as yet. And the best way we can protect them is by having as many people around them vaccinated. So anyone older than 5 and adults if we're vaccinated, we're also protecting those kids that are younger who can't be vaccinated yet. And that's also brings up another point, which is, as Liz said before, it's really important to isolate. If you or a family member have COVID, to just isolate for 7 days and not see people, so we're not spreading that into the community.
Definitely. So we'll just quickly go through. Everyone should be aware of this already. Face mask needs to be wear properly for it to be effective. We want to wash our hands, use hand sanitizers, especially every time when, you know, like a kid came home, or if you've gone outside, or if you've touched something that some other people, like a public place. You also want to make sure that you're social distancing as well, as much as you can. Now we want to move on and talk a bit more about how we can talk to our children about COVID. What do you guys think? Is it quite difficult, especially for younger children? Do you think that they will understand what is COVID and what's happening in the surrounding world? Does any of the audiences have, you know, personal experience about talking to the children about COVID, how they explain about it?
Well, I have a 4-year-old grandson, and he has a video that says that there is a virus out there. It's making people sick and people can die. So you need to wash your hands every time you come home from childcare and before you eat. So it's very cute, actually. I'll share you the video sometime.
Oh, that's great.
Where did he get it from, Marissa? Did someone make it?
No, his mom. So my daughter-in-law filmed him talking about the virus, and he has a lisp. So he goes, the virus can make people sick. It's very cute. I actually shared it on my Facebook page, but
Good.
That's why we're doing a lot of work with kids now, because a lot of them are actually also experiencing not the physical side effect of COVID, but the mental side effect of COVID. Like some of the kids that were born during the lockdown, they don't like being in public or having a lot of people around. So we're going to actually do some more projects on getting kids to say in a forum or through art how they see COVID, how they see this pandemic, because I think that, you know, there's a different breed of young kids after this pandemic growing up and being exposed to this COVID situation. But the other thing that I wanted to ask about is, you know how I have a 3-month-old baby girl granddaughter who got COVID because the father was infected from work. He got it from work. How do we cope with this? I was really so stressed because babies, I think 2 years old and above, they can say what they feel. But if we're talking about infants as young as 1-2 months old, and there were a few of them, my children's babies as well got infected, and of course they cannot tell us how they're feeling. So how do we react, or how do we respond as their carers when a baby below 1 year old gets COVID positive? Do we bring them to the hospital, or how do we cope with that?
Do you want me to talk to this as a parent?
Oh, yes.
So, yeah, and then maybe Marissa could also share what they did, because I don't think there's a magic answer, Marissa, but I think you should share what you know, Tracy.
Well, I think like any illness in our children, we provide the care we can. As we've said before, you know, kids don't tend to get too sick with COVID, but, you know, a kid with a runny nose, a little baby with a runny nose, it's pretty distressing. It impacts their sleep, and it impacts mum and dad's sleep. And yeah, we can just provide the normal care. They might need to have maybe feeds a little bit less, but more often, like a smaller feed, but more often, keep them hydrated. But as with any condition or any disease or infection, I think the key to remember is if you're really concerned about your child, absolutely seek medical attention. And if you're unsure about taking them out, just give your GP a call and ask them, call Nurse on Call or, you know, one of those hotlines. And if you're really, really concerned, you can take your child to a hospital, you can call an ambulance.
Yeah.
So, you know, if you feel like they're really unwell, you still have access to medical care. But otherwise, it's just treating them, you know, as you would with any other condition, just providing for their needs, trying to keep them comfortable, trying to keep them hydrated.
Yeah, and certainly I think for babies, especially for kids who's under 1 year old and can't really verbalize what they're experiencing, as I always say that parents know their kids the best. They look after them from a daily basis and they know what their routines are and how they usually behave. So if a baby, say, had COVID, when do you get concerned about per se? It's like, for example, if you're worried about babies not really getting enough oral intakes, like, you know, they're not interested in having breastfeeding, they're not interested in even half of the usual milk that they would drink in a day, then sometimes you wonder, is my baby, boy or girl, getting quite sick? The other symptoms would be like if they're getting really irritable and then you just cannot console them, regardless of what you do, that could be a sign of that they're in pain or in discomfort. And certainly that could be pay attention for as well. And as Tracy talked about, anytime when you're concerned about how your babies are behaving, telehealth is I think it's a wonderful new not an invention, but something that's brought in by COVID to our general community to, even if you're in isolation, if you can't go and see a doctor, at least you can do telehealth consults with them and discuss with them about your concerns. And they're usually able to gather from the clinical history whether or not you should bring this baby to the emergency department or not. And as I agree with Liz and Tracy, certainly at any stage that you're concerned, do not ignore them because parents know their kids the best. If you're concerned, get medical help. Yeah.
I will quickly say though, Marissa, you asked, oh, do we need to take the baby to the hospital when they're positive? You don't have to take them straight to the hospital just because they're positive, okay? But like Michelle and Tracy said, as a parent, if you're worried about your child, if they're not feeding well, if you're worried about their breathing, the hospital or telehealth is always there. But there's a lot of babies and children that are staying at home with their family during COVID and they're managing completely fine. So I'm sure it must have been terrifying for you and your family, 3-month-old baby, and definitely not the father's fault. You know, I think people worry about that, like, oh, it's my fault, I gave my baby COVID, but it's no one's fault. It's just about making sure that everyone stays safe.
Yeah,
certainly.
And just you've asked me to share, and I just want to share it just in case the community experiences the same. I actually was the one who panicked and was insisting for my daughter to bring the baby. She was 2 months old, to the Royal Children's Hospital. It's a good thing my daughter is a nurse. She's a mental health nurse though, but she, of course, being a nurse, she knows when to panic and when not to panic. But she called the hotline and was referred to this COVID care clinic. And this is something I think, because I experienced the same thing too. They call you every day. Sometimes it's a pain because they send you this every morning. You get this
the survey.
And they ask you, how are you feeling today? And of course, when you're sick, the last thing you want to do is answer a survey. But I just want to tell the community, it's when you answer the survey, they know when to get a doctor to call you. And in the case of my 2-month-old granddaughter, someone from the Royal Children's actually called my daughter and did a phone assessment. And the good thing about it is she was told that my granddaughter wasn't a high risk. She was still feeding, and mind you, she was feeding very well even with COVID. The only thing I guess that was different was she didn't want to be put down. She wanted to be carried all the time. I guess everyone, when we're feeling sick, we want cuddles. So and it's difficult because both parents had COVID too. So I guess and the grandma cannot go there to help babysit because they're in isolation. So if there's anyone in the community with children below 1, don't worry, because when you answer the survey, they will assign a specific doctor or nurse practitioner to actually make sure every day that there's no bad effect on the baby. So so that shut me up from insisting that she be brought to the Royal Children's Hospital.
I see. I
Yeah.
see. Yeah.
And
Thank you for sharing. Yeah, thank you for sharing those stuff, because I think that's important. And you know, if they had gone to the Royal Children's Hospital, there's a chance they would have had to wait quite a long time. So potentially that's a good outcome, that they haven't had to leave the house. You know, it's not nice if you're feeling sick to have to go and wait in a waiting room. So it's good that they could get the call from the nurse or doctor on the health line and make sure everything was okay.
And I think it not just only applies on little babies as well. There's certainly other services around that's been keeping an eye on those people who are vulnerable and got COVID. Certainly for even in women's health, like we I don't know about every single hospital, but certainly the hospital that I've worked for, we do keep track on the pregnant woman who's got COVID, and every few days we either us or one of the midwives will call them and making sure that they are feeling fine, that baby movements are feeling okay, and to make sure that they don't have to present to the hospital for emergency care. Yeah. Tracy, did you want to comment on something?
No, that's great.
I suppose just going back to this slide that we're talking about, we have talked about little children, and Marissa has spoken very well about small children that may not have been able to socialise or go to childcare or do the things that we expect small children to do. This is affecting a lot of people, not just small children, up through teenage adolescence. And so we're really encouraging parents and anyone that's around children to feel empowered to talk to children about COVID, see what their understanding is, and try and be a role model of calm and sensible behaviour, because it can be pretty scary, and I think people are getting anxious at different levels, and so it's good to be able to talk about it, I think. Let's keep going through our slides, hey?
Yeah, just something on that. There's been a recent study on the global prevalence of mental health across the world during COVID, and they studied more than 80,000 children aged 18 years and younger, and found that globally 1 in 4 children have increased depression symptoms and 1 in 5 increased anxiety symptoms, and that these symptoms have been worsening, these rates have been worsening as the pandemic's progressed. So it is really important just to keep in mind that this is really impacting our kids. And, you know, it's not about the kids necessarily getting COVID. It's just the environment we're in, where there's stress, where everything's got to be thought about, where, you know, school's been off and on for the past couple of years. Kids haven't been able to see their friends or keep their routines. It's really, really important just to keep talking to them and really listening to them. But also encouraging them to seek help if they need someone to talk to call, you know, Kids Helpline, or, you know, one of those Headspace, or one of those organisations that's there to support children's mental health.
Definitely.
And I think we talk a lot about, you know, side effects of the vaccine or side effects of COVID, the illness, but we don't necessarily talk about the other effects that COVID has on our lives. So I did a bit of reading about this long COVID that we hear about and how it presents in children. And actually they said that because there's a lot of children suffering from anxiety and depression, it's really hard to differentiate if they're suffering from long COVID or they're just suffering from anxiety and depression related to a differing lifestyle. So I think that's important. Thanks for those stats, Tracy. Yeah, 1 in 4 with depression and 1 in 5 with anxiety is a lot of our population. Making mental health a priority. Thank you, Michelle.
Exactly.
This is important. I think we've all seen similar slides to this, but we need to prioritize it for ourselves, for our family, for our children, for our community. Trying to eat healthily, get good sleep, stay connected to the people that we love, and to exercise, to be outside if it's possible. I think we know that these things in differing amounts for different people can really help to lower some of those feelings of anxiety and depression.
And certainly moving on as well, I think it's very important that we still keep a good relationship with our families and friends, regardless of how far away we are from each other or whether we are in isolation or not. Putting aside more time essentially for the people who you care about to connect with them, whether it's via Zoom calls or FaceTime, or certainly now when the restriction has eased off a little bit, maybe for like a family picnic or barbecue time to reconnect with your close families and friends. And also to listen what people are saying, like listen to what their feelings, and to be honest about how you feel as well. If you need someone, if you're feeling down or upset, if you have concerns, there's always good that you approach someone that you could trust, like your families or friends, so that you can be heard and supported by other people as well. And certainly with, as I said, good quality family time is very important in this time to keep us mentally well and feeling supported. Even if you're at home, there's a lot of things that we could do with our kids. If your kids like, active games or sports, you guys can go out for skateboard sessions or football sessions together. If they like to stay at home, maybe some art and crafting, new hobbies that you could develop, and certainly outdoor as well. If you want to go out for a family picnic while in somewhere that has good ventilation and COVID safe, is a very good idea. Tracy, would you like to comment on that? How to look after?
I think we've
addressed
that very well so far. Yeah, maybe we'll just move on.
Very good.
We've talked about that as well. There's those lines.
Yeah. So these ones, we've got Lifeline, Headspace, and Kids Helpline as well. So they're all very good resources that you could get help from and talk to somebody if you're concerned.
We did have a question which I might just throw in here. Someone was asking about the new subvariant. How is it different from the original Omicron variant? I'm happy to take this if you like.
Yeah, that'd be great.
Yeah, okay. So research is obviously just at the beginning stages because so they're calling them BA1 and BA2, the two Omicron variants that we have here in Australia. And they have spread around the world, but they're dominant in some countries and not in others. In Victoria, I understand, I heard the other day that Omicron BA2 is our most common variant at the moment. So don't quote me on that, but that's what I heard. So the early studies seem to show that BA2 is more contagious than BA1. And we are seeing an increase in Victoria, at least, of cases gone from around 8,000 or 9,000 a day to sort of 11,000 a day. So we have seen that creep up a little bit in the last week or two. And there is also some thought that maybe it is the BA2, the new variant, is a little bit more immune resistant, so fighting a little bit harder to get into our bodies and to resist our immunity. They are showing that in sampling that they've tested, samples from fully vaccinated people show a stronger effect against all the variants compared to people who've only had one dose of vaccine or who haven't been vaccinated at all. So the encouragement is to, please, if you haven't had your vaccines or if you haven't had your third dose, And we know that in Australia, third dose uptake has been quite slow. So we do encourage you, because we are having new variants come out, and you know, this is important for kids too. You know, we often get the question, you know, why should I vaccinate my kids when, you know, they haven't gotten that sick and, you know, they've generally been okay. Well, the kids' vaccination schedule came out at a similar time to the first Omicron variant, which was milder in severity, according to many reports, than the previous Delta strain. And yeah, kids don't get as sick, but there's new variants that have come and are coming. And as long as many places in the world remain poorly vaccinated with really low vaccination rates, we will see new variants. And we don't know what variants might come. We don't know if a more severe variant will come. But vaccination does consistently prove to be our greatest response and our greatest protection against variants as they come. So, you know, this early studies show that a third shot does increase our protection against the new Omicron variant as well. And time will tell what happens next. Yeah.
And Tracy, I just read before this that there's also a fourth dose coming for some people. So I think in April, it's been approved that there's only a certain subset of people. I think it's people over 65, people in nursing homes, people with severe immune problems, like Michelle mentioned, leukemia. And I think that will be doctor run as well, or you might hear from GP, or you might be reached out to say that you're eligible. But it's interesting. I live in Tasmania, obviously. We only opened the borders at the end of last year, and we were prepared for a lot of people coming to the hospital, but it's actually been okay because of the vaccination rate. So I think it's really good to reflect on that. Even though we think Omicron is less serious, actually it's come when we've all been vaccinated, and that's probably, or most of us have been vaccinated. And so the reason that people maybe aren't getting as sick is because we have some immunity in our body. And if you compare Victoria during Omicron versus Delta, we saw that everyone was much sicker then, and that was when we didn't have the same vaccination rate. I saw there was just a question about flu vaccine, and Tracy and I spoke. It says, will the COVID vax be like the yearly flu vax? Did you want to answer that, Michelle, or I can do it? I don't mind.
Yes, certainly. I think at this stage, it's very hard to say whether it will become like a yearly flu vax or not. We have seen that there has been, like the COVID has multiple different new variants and sublineages. So there's certainly a possibility, because we do know, looking at after you've had a second dose, or even after you've had a booster dose, your immunity does drop off by time. And say if the new variants can be quite severe or can cause severe illnesses, then that's something that potentially will be required in the future. But it's certainly very hard to say at this stage, because things are changing. Maybe one day we don't have COVID anymore. That's the hope.
Maybe.
Maybe.
I did just want to raise very quickly, I think we already touched on this. Tracy asked, we got a question, is it a must? Do kids have to have a vaccine? And it's not a must. Kids don't have to have a vaccine, but we definitely know that, as we just talked about, that even if they're not getting sicker, it's helping to make sure the whole society is more covered, okay? And we don't know what the new variants are going to be like. Yeah. Do we have any other questions? Marissa, I saw you've just asked for people.
Yeah, I have a question, Liz.
Fantastic.
With the subvariants coming in and new others for sure, and with Victoria and New South Wales, the new cases daily are extremely high, and the government's predicting that it will even get worse as winter comes. So do you think that it's possible we could be on lockdown again, or is this an option that they're looking at to prevent, the swelling of numbers, since winter is the flu season, wouldn't it be better to maybe contain people again, or just because we vaccinated, they're not stressed anymore?
Look, I think let's throw it open to everyone, but we don't have a crystal ball, unfortunately, Marissa, so we don't know. But I think a bit about what we were talking about before is that we know that there are a lot of other effects of having lockdowns and of people not being, kids not being able to go to school, people not being able to work, the economic side effects of not having the same kind of business. And I think governments all around the world are doing a lot of research into that. I strongly think that how the healthcare system is going will be a predictor of the need to lock down or prevent movement. And I believe that in general, we're going okay at the moment. It's not like with Delta when there was no intensive care beds and, you know, people were really sick and were dying at home. With the vaccination, we're doing slightly better than that. So it's hard to predict the new variants, what's going to happen. But we know that having lockdowns has some other really serious side effects, and with people not being as sick with COVID, maybe the effects of lockdown are worse than people getting COVID.
I think Melbourne has a question too. Do you have an Australia-wide statistics about death caused by the vaccines?
Do you have that stat, Michelle? Have you been looking at Monash's things or?
No, I don't actually have a number on top of my head.
Have a look.
Yeah.
I can have a look. ATAGI, Melbourne, ATAGI, which is the Australian Therapeutics Goods Against Immunisation or something like that, ATAGI. They were publishing details when we were having quite a lot of side effects with AstraZeneca. I'm not sure if they're still, but I'll just have a quick look now. If there's any other questions, I can see if I can find the answer.
Yeah. What about in the audience? Would anyone want to raise their hand? Is there any question from our guests from our community?
Yes, I have short two questions. This question is raised from my community member, always asking me. And one thing is like, after getting COVID, and is there any chance to get again? And some people say that there is we cannot get any more COVID sicknesses. They said something, this news are roaming that my community. And second one is like, now we have this COVID vaccine. So do we need to have again, like normal vaccine, means before COVID, we used to have a vaccine once in a year. That one, do we need again that one? And they asked me that one. So I don't have any idea to answer. So what I will give answer to them.
Yeah, great. Thanks for asking these two questions. So I will probably start with the first one and feel free to jump on. So regarding whether or not you can get COVID again once you've had COVID, the answer is yes. And certainly even in clinical settings, I've seen people who got their second or even third COVID infections over the last 2 years. So how it works is that your body will generate an immune response and produce what we call antibodies. And the antibodies can wear off over time. And certainly in the first 1 to 4 months, as the ATAGI recommended, is that you still have the immunity, and if it's less likely that you will get COVID during that period of time. But your immune system does wear off over time, and the memory with, like they forget about COVID, and when you get in contact with people who has COVID again, you can certainly get infected. So the current recommendation is that if you've had COVID and you haven't got your second or third dose of the vaccination, You can wait up to 4 months. You can delay the vaccination up to 4 months. But certainly, if you're working in somewhere that's high risk, like nursing homes, if you work in a hospital, they will still recommend you to get the COVID vaccine earlier, as long as you are fully recovered from the condition, which implies on if you only have like mild sort of dry coughs lasting for months, that's not that you're not recovered. So that's still acceptable. It's more the acute phase has gone past, that you're not febrile anymore. You're feeling like you're pretty much back to the baseline and you can get the COVID vaccine again. Does anyone want to comment on that or move on to the second question?
Yeah.
Okay, so I think Zo's second question is about whether we should continue getting the usual vaccinations we used to get before COVID. Tracy or Liz, would you guys like to comment on that?
You go,
I'm happy to
Tracy.
comment on that. Yep. So yes, absolutely. There's been some concern that throughout the COVID period, everything's been focused on COVID, and many people have not necessarily been getting, their vaccinations for other things. Maybe also their checks, their health checks, breast scans and cancer scans and those normal health checks, diabetes checks. So there's a real push now for people to please go and get those checkups happening again and those screenings happening, but also, yes, your regular vaccination. So the childhood vaccination schedule is still really important. And you can actually have, if your child is due for a COVID vaccination, they can have their COVID vaccination at the same time as they get their childhood vaccinations. And you can also have a flu vaccination at the same time as you get a COVID vaccination, if that helps. But we are really encouraging people to get their flu shot once that becomes available, particularly for our kids, because any kid who is 2 years or under has probably not even been exposed to the flu, because we haven't had much of a flu season in the last 2 years, and that means they'll have no antibodies against flu and will be very susceptible to pick up flu. So we really encourage people to get their flu shots, to have your children get their flu shots as well.
Perfect. Marissa's just given us a 2-minute warning, so I think that's very timely. I just wanted to really quickly say to Melbourne's question, I shared in the chat, it's a very wordy document that the TGA publish every week. But just very quickly, I found healthcares can report problems with vaccines, and there's a total of 11 deaths that they've attributed to vaccines in Australia. So that's 11 people, and there's been 56.2 million doses of the vaccine. So it's a very, very small amount, and there's no there's no reports of any problems with children, no deaths in children or adolescents. And that's actually, a lot of those deaths were with the AstraZeneca vaccine. They're not from the myocarditis, pericarditis. So yeah, Michelle's got it on the screen. It's a very wordy document. I wouldn't really recommend reading it. It's very complicated. I had to stroll through it, but it said 11 deaths, so it's not very many. Yeah. I suppose we should say thank you. I don't know if we have any other.
Well, you ladies have been fantastic. I think there's a lot of our attendees who already expressed their thank you and their appreciation for all the information that was shared to us. Thank you, Apple. Now, to the Filipino Australian community who are watching this on live stream or on Facebook, you can still view this from the beginning on our Facebook page. Please share it. I think the percentage of vaccination among children between the age of 5 to 11 is still very low. Is that correct, ladies? Yeah. From the statistics I saw, it was below 30%. That could be attributed to the parents or the carers' fear of having the children vaccinated. We've had a very informative session tonight. Please share this to the community. It will indeed help alleviate their fears. And as our health practitioners mentioned, the the fear of having the side effect far way outweighs the fear of what's going to happen if the kids have COVID or if we have COVID. And thank you for being our presenters tonight, Liz, Tracy, and Michelle. Thank you to the Waterwell Project. Maraming salamat to the Filipino community in Melbourne for joining us tonight, and to the crew of GAWAD KALINGA as well, Melvin, who's been very good as our technical coordinator.
Yeah.
If you have future questions, just post the question on our Facebook page in GAWAD KALINGA Australia, and we will forward them to our Waterwell Project team if we cannot answer them. Again, thank you very much and have a good evening.
And we'll just quickly say thank you very much from the Waterwell Project again to GAWAD KALINGA for having us. We really appreciate these sessions, and it's great to get to see other members of the community. That's what we do our work for. So thank you very much.
Thank you. And that ends our live stream, Melvin. Bye, everyone.